Thanks everyone for tuning in. So this is a series of questions and answers regarding dry needling. We're really excited to be offering dry needling to the community. Here at Physical Achievement Center, the doctors of physical therapy have specially training in this and are looking forward to serving you better with the use of dry needling. So there's a number of questions I'm going to go through today. I'm going to answer questions regarding the commonly asked questions regarding dry needling. So, for starters, what is dry needling? Dry needling is what doctors of physical therapy here at Physical Achievement Center use as an adjunct to other treatment, in addition to other treatments, to help individuals recover faster and more completely from pain, muscle injuries, and limited mobility and strength. We're attempting to get people quicker back to their work, home, life, sport, and recreational activities. So dry needling allows us to increase the speed of the healing and recovery and get people back quicker with less time. So we use thin needles, in this case acupuncture needles, that are inserted into and near joints, muscles, near nerves in order to stimulate a healing response in painful musculoskeletal conditions. Again, Doctors of Physical Achievement Center here are using this as an adjunct in addition to other treatments. We'll talk more about that later. So the second question is, what conditions does dry needling help with? So there are many painful conditions that can keep you from your active life and keep you from living your best life. So this is not an all-inclusive list, but this is a list of some of the common conditions that are treated with dry needling. First, spine conditions such as painful neck, upper back, and lower back conditions, including sciatica. Another area that's commonly treated with dry needling is shoulder and arm pain. Shoulder pain can also include issues of arthritis and issues with the rotator cuff, or issues of shoulder instability or subacromial impingement syndrome. Another common area treated very successfully is knee pain. Knee pain that's related to arthritis, or knee pain that's related to meniscus strain, or even degenerative meniscus. Arm pain and elbow pain, such as tennis elbow, golfer's elbow, and for those of you who do pickleball, we'll call pickleball elbow, can be treated very successfully with dry needling. Headaches are another condition that have an extremely high success rate, especially migraine headaches and also tension headaches. Dizziness can also be treated with dry needling. Very effective for dizzy conditions and for conditions that relate to disorders in the upper neck. Hip pain, whether it's hip flexor problems, whether it's problems on the side of the hip, IT band, or maybe the back of the hip with piriformis syndrome, are treated very successfully with dry needling. Scars, whether they be from surgery or past injuries, are very effectively treated with dry needling, and we're going to talk a little bit more about those a little later on. So in short, there's a wide range of issues that can be treated successfully with dry needling by the doctors of physical therapy at Physical Achievement Center, and we're going to answer more questions coming up. So a question I'm commonly asked is, how does dry needling actually work? Well, the doctors of physical therapy here at Physical Achievement Center are happy to use dry needling because it has so many beneficial effects. First of all, there's a number of happy chemicals that the body actually produces as an effect of the dry needling. These happy chemicals help reduce pain, decrease inflammation, decrease stress, increase your mood, and most importantly, decrease your recovery time and get you back to your active life quicker. There are some well-known chemicals that the body produces that dry needling helps to stimulate to help with the painful healing response. Endorphins and enkephalins are some of those. Those are mood-elevating chemicals that are oftentimes associated with runner's high or exercise high. Cannabinoids, yes, cannabinoids. The body has its own ability to produce cannabinoids in the tissue, and when dry needling is utilized, the body is stimulated to release some of its own natural cannabinoids to help with pain relief. Norepinephrine is another chemical that the body can release to help produce pain relief. And there's one more that's really cool, decreasing levels of cortisol. Cortisol is a stress chemical that the body produces when it's under stress, and certainly painful conditions evoke stressful conditions, and cortisol levels get elevated with stress and with painful conditions. So dry needling can help calm, relax those nerves, thus decreasing the release of cortisol to help you be more comfortable and to rest and sleep more comfortably, along with increasing your energy. Dry needling helps decrease overall nerve irritation from painful conditions. That is pretty exciting to hear about. We'll talk more about how that relates to sciatica and lower back pain in a little bit. The actual muscle spasms that can occur, painful knots, painful knots in the upper neck or in the back of the hip or in the lower back, those can be relieved quite dramatically with the use of proper dry needling. Other effects of dry needling include repair and regeneration of tissues and improving circulation, and has been reported to improve bone health and cartilage growth in arthritic and degenerative conditions. And one of the most powerful techniques to help improve scar flexibility and that chronic stiffness you can get is by having the dry needling help with the connective tissue stretchability deep in the tissues. We'll learn more about that in a little bit. Another common question that I get is dry needling the same as acupuncture? I want to let you know that I've been a consumer of both acupuncture and dry needling. And there are some similarities, but they are quite different experiences and quite different effects. So the first thing is they use the same sort of needles. So an example of the needle is right here. This is a 40 millimeter needle inside of its tube. It's not a very big needle. So acupuncturists and physical therapists both use the same needles. That's where the similarities start to diverge. I'm going to talk a little bit about the training, the goals of each, and the intention of each. So first of all, doctors of physical therapy have over 2,000 hours of clinical training over at least 7 years. Licensed acupuncturists have a minimum requirement of 600 hours and 2 years of certification. Doctors of physical therapy focus on pain relief with using research-based programs to help improve posture and movement. Acupuncturists focus their treatment on the movement of energy, or qi, through the body along channels called meridians. Acupuncturists tend to work more with the system of traditional Chinese medicine, a centuries-old tradition, whereas physical therapists are using modern-based understanding of how muscles, bones, and joints work. The doctors of physical therapy at Physical Achievement Center work with dry needling to help improve muscle and joint movement, to allow for improved posture and movement ease, to help get you back to your active life with the least amount of medications, minimizing drugs, and without surgery. We want to get back to your active life and to help you as an adjunct to other great things we do at Physical Achievement Center. Next question is, how long should a session of dry needling be? That's a great question, and a question I love to answer. The short answer is 15 to 30 minutes, and we're going to explain why. First, I want you to understand that the doctors of physical therapy at Physical Achievement Center want to provide the best treatment approaches for getting you back to your active life. There are some clinicians, in fact a majority of clinicians, who when they use dry needling, they place a needle in for a couple minutes, awaiting for a muscle twitch response and awaiting for that muscle twitch response to end, and then pull the needles out. That's not the best way to use dry needling, but that's a common way and the most common way that's utilized in physical therapy clinics. We do things differently here at Physical Achievement Center. And the reason we do things differently here at Physical Achievement Center is because we know not only research proves and clinical results show that 15 to 30 minutes is the best amount of time for dry needling. So there's little research to show that needling less than 5 minutes or 10 minutes offers the same sort of lasting benefits as done with needling sessions that are 15 minutes plus. The good news is you don't have to worry about how many minutes you need for dry needling for your condition. The doctors of physical therapy will do a thorough assessment and give you the proper dose and timing of the dry needling in order to help you get back to your active life with the least amount of pain, least amount of medications, and with the least amount of worry for surgery or having to live with it. Another common question I get is, should I consider the use of electrical stimulation with dry needling? And if so, why? The short answer is absolutely. Doctors of physical therapy want to give you the best treatment with your dry needling. For most painful conditions, the use of dry needling in combination with electrical stimulation gives you the best response. The cool thing about electrical stimulation with combination of dry needling is the healing electrical stimulation is directly into the tissues because the needles are in the tissues that are inflamed and irritated. That dramatically improves the healing response and the effectiveness of the needling. So many people are familiar with TENS units in which patches are applied to the skin. In order for that electrical stimulation from skin patches to get deeper into the tissues, that intensity has to be turned up quite high. Dry needling, on the other hand, doesn't need that same level of intensity because the needles are already in the painful, irritated, and inflamed tissues. So we definitely consider the use of electrical stimulation with the use of dry needling, and fortunately the doctors of physical therapy can help you decide whether or not your condition is better treated with or without the use of electrical stimulation when you receive dry needling. Another question I get is dry needling all I need to get well? In other words, do I have to do anything else? Well, it depends. For the most part, if you want better results in a quicker time period, you're going to want to consider dry needling not as a standalone treatment, but as an additional treatment to other things that we do. Dry needling, you see, can be helpful on its own, but it's not as long-lasting or as thorough of a treatment as when it's combined with other treatment. The Doctors of Physical Therapy at Physical Achievement Center utilize a prescriptive plan of care in which we carefully select a number of things to help you to recover faster. One of those things is we want to correct joint stiffness problems and pain. We utilize that through a number of different techniques, oftentimes hands-on technique that range from gentle mobilizations to even some joint manipulations or mobilizations that might involve cracking your joints. We also teach people how to retrain their posture and movement muscles to get muscles moving better so you have less tendency to re-aggravate your condition. We focus on strength and flexibility as well. Flexibility, otherwise known as mobility, would be where we attempt to help the joints move and keep that movement going with greater range of motion. We also work with strengthening the muscles to help support you in your active life to keep things from getting back to where they were when you started a painful condition. In summary, if you use dry needling alone, you're looking at either short-term results or you're looking at the necessity for anywhere from 18 to 20 or 24 sessions of dry needling to get the effect. That's what the research shows. When you use dry needling that's incorporated into a comprehensive plan of care that the Doctors of Physical Therapy will prescribe with you and work with you on, your results can come in as little as 6 to 10 or 12 sessions. The next question that I often get is, how many sessions of dry needling do I need? Well, the answer to that, it kind of depends. It depends on a number of things. First of all, it depends on how severe your condition is. It also depends on how long you've had your condition and how bad it's gotten. Your health status and your overall health conditions can also play a role as well. We notice that results are often noticeable with the first session. Considerable improvement is typically noticed within 4 to 6 sessions. I always say one needs to attempt dry needling for at least 4 sessions. If someone attempts 4 dry needling sessions, they can truly say that they've tried dry needling. Anything short of that, and you really haven't tried dry needling. And again, the typical treatments that are needed to get results can range anywhere from 6 to 10 or 12 sessions when the Doctors of Physical Therapy at Physical Achievement Center help you with a comprehensive plan of care. When you utilize dry needling alone, it typically takes much more than 12 sessions and sometimes up to 20 sessions. That's why we like to say it depends on what else is going on in your treatment plan of care. Do I need to keep doing dry needling to keep the benefits? In short, most individuals don't. Dry needling at Physical Achievement Center by the Doctors of Physical Therapy are done with a comprehensive plan of care that help you get better movement patterns, better strength, better flexibility. You'll have a nice, tight, concise self-care program to help keep you that way. Some individuals who have a chronic condition that's been around for many years, or episodic issues such as migraines, such as tension headaches, or chronic conditions such as osteoarthritis of the knee or shoulder, might benefit from needling sessions to be done on a regular basis even after you've achieved your results. It's kind of like some people who take anti-inflammatory medication for an ongoing condition, or other people might take some supplementation for different conditions to take it on a regular basis. How much, how often? It depends. Anywhere from every other week to once a month is suitable for most conditions that need to be managed on a regular basis. So typically, once people find out more about dry needling and they start to think about it, they think to themselves, needles, does it hurt? So the answer is, for most people, it's a minor irritation, if at all. Some people don't feel it at all. Very rarely, in fact, I can only think of one person that I've ever treated who didn't want to have dry needling again because of the discomfort. I'm personally not a big fan of needles. However, I'm willing to use dry needling because of the effectiveness that it carries. We want to keep in mind that these needles are very tiny. In fact, I'm going to give you a sample of what this looks like. So this is a needle, and I'm going to hold it up, and it is so tiny that even as I reach it out towards the camera, you're not going to be able to see it. These needles are 0.2 millimeters long, wide, and varying lengths. So 0.2 to 0.25 millimeters is not very long. I'm going to give you a little demonstration about how dry needling looks. So first of all, each dry needling session is done with needles that are in a clear plastic tube that are sealed. Dry needling is a clean technique, not a sterile technique. These needles are just used for one person. Once it comes out of this tube, it's done. So you would insert the needle into painful tissues. In this case, I'm imagining that I have maybe some tennis elbow, and simply release from the tube, tap it in, and insert it into the painful area. And typically it's a little bit of a sting to not much noticeable at all. Of course, there are times people can feel it, but typically it's very beneficial. Then at the end, once we're done with treatment, we simply pull it out and we discard it into a sharps container. So, in short, dry needling, especially when done by the specialist, doctors of physical therapy at Physical Achievement Center, is almost never a painful condition. There's a minor level of irritation for some individuals, but it doesn't hinder people from experiencing it again. Another question that's sometimes asked is what research is behind dry needling? So there's actually quite a lot behind dry needling, particularly dry needling that's done in a comprehensive way like the doctors of physical therapy do at Physical Achievement Center. There is robust research in a number of areas. One that I'm really excited about is knee pain related to osteoarthritis. A recent research project showed that when dry needling is utilized in a comprehensive way with other activities that the doctors of physical therapy already do at Physical Achievement Center, individuals with big-time knee pain and arthritis get significant relief. They have a substantial reduction in the use of medications, a substantial reduction in the amount of pain, much more strength, and much more ability to do things. Dry needling is also research supported for lower back pain and sciatica. There's some terrific research in that area as well. Plantar fasciitis, or pain at the bottom of the foot, is treated very effectively and research proven for that condition. Neck pain and arm pain related to neck pain is treated very helpfully with the use of dry needling. Research supports that as well. Another area of research that supports the use of dry needling is the use of headaches, both tension and migraine. An additional area in which people get substantial relief from dry needling is with dizziness disorder. And we're really excited about being able to offer that. Again, there's a lot of research that supports the use of dry needling, particularly the comprehensive style of dry needling that's done at physical therapy, in which we use needles in place for 15 to 30 minutes. Dry needling in these research projects are best done with other healing modalities that the doctors of physical therapy do at Physical Achievement Center every day. So how does dry needling help with lower back pain and sciatica? So there are many ways that dry needling helps with lower back pain and sciatica. First, dry needling helps to relieve the pain and muscle guarding and inflammation in the spinal muscles. Secondly, dry needling helps to improve the flexibility of the spinal segments for easier movement and easier upright posture. Dry needling also helps reduce the nerve sensitivity both in the back and in any nerves that are associated with the back, especially as it relates to pain that extends down into the hip region, back of the thigh, or in the sciatic down to the ankle and foot. And the next area in which dry needling is helpful for lower back pain and sciatica is a substantial reduction in the irritability and the pain in the sciatic nerve. The sciatic nerve is the longest nerve in the body, and it extends from the back, down the back side of the hip, down the leg, and down into the ankle and foot. So we're really excited about being able to offer dry needling for folks that suffer from lower back pain with or without sciatica, because it's so helpful when used in addition to the things that we already do at Physical Achievement Center. How does dry needling help knee pain as it relates to osteoarthritis? So we seem to be hearing a lot of bone-on-bone description of knee conditions, otherwise known as arthritis. So in arthritic conditions, or in conditions in which there is wear and tear of the meniscus, known as degenerative meniscus, there can be lots of pain, stiffness, and weakness. When dry needling is used in combination with other things that are commonly done at Physical Achievement Center, the results are pretty dramatic. When we can help it free up the joint flexibility and minimize the joint irritation with the use of dry needling in combination with hands-on work and proper exercise prescription. Muscle work and stimulation of the muscles through the use of dry needling helps to further improve the strength and mobility and diminished pain that people get from dry needling. The prescriptive exercise program that people get to help maintain the improvements in flexibility and strength for their active life adds to that benefit. So the neat thing is that all these benefits of using dry needling in combination with the things that we commonly already do in research projects and in the clinic show dramatic benefits for individuals who maybe are just focused on getting around the house and the community, to individuals who are wanting to be much more active and do much more vigorous things, such as hiking, marathons, and getting back to their sport. Again, dry needling is amazing in the clinic. I'm extremely enthusiastic and excited to offer that to individuals who are suffering from knee pain that might be related to arthritis, degenerative meniscus, meniscus irritation, or routine stiffness in the knee. How does dry needling help with neck pain and shoulder pain related to neck and upper back problems? Well, first of all, dry needling helps to dramatically decrease the pain coming from the nerves of the neck and upper back that can irritate the head, neck, upper back, shoulders, and even arms. You see, the downstream effect of irritated nerves in the neck and upper back have their effect in bringing on headaches, bringing on pain in the shoulder, bringing on pain down the arm, in the forearm, maybe even into the hand. So dry needling helps to dramatically lower the irritation and the nerve sensitivity in the neck to diminish the irritated nerves in order to get back to a more mobile, more comfortable activity of the arms, hands, and elbows. So the combination of typical things that we would do in physical therapy here at Physical Achievement Center, utilizing hands-on approaches to improve the mobility, utilizing exercise prescription to get muscles back to their proper form, and devising a prescriptive exercise program that's individualized to you in combination with dry needling helps to decrease your overall reliance on medications, drugs, and considerations for surgery, all while helping you get back to your active life in the shortest time possible. Another question that I hear asked sometime is, are there conditions that aren't good for dry needling? Actually, there are very few conditions that aren't appropriate for dry needling. Most of these are classified in 3 categories. The first is if someone has a profound fear of needles, needle phobia. We're not going to needle somebody who has extreme anxiousness about needles. The second area of concern would be an individual has some high risk, very high risk of infection or active infection in which they're currently seeking aggressive treatment for. A third condition that we may want to consider getting some input from an individual's primary care provider before doing dry needling would be those with severe bleeding disorders. Simple communication with the primary care provider would help us steer the direction the right way to avoid any unintended problems. And ladies, women who are pregnant, dry needling can be very effective, but we're going to make sure and check with your OBGYN or your nurse midwife before going ahead with treatments so that everybody's on the same page regarding the safety and effectiveness of dry needling. So we're delighted to be able to offer dry needling in combination with the other things we do here with the Doctors of Physical Therapy at Physical Achievement Center. And there's very few conditions that we can't treat effectively with it, but there are some considerations. Fortunately, the Doctors of Physical Therapy here at PAC can help determine what's best for you and your condition. Another question that I get is, does my insurance pay for dry needling? Straight up answer is most insurances don't. The good news is the Doctors of Physical Therapy at Physical Achievement Center don't work for the insurance company, they work for you. So here's an important thing to keep in mind. There are a lot of clinics that utilize dry needling for a very brief amount of time, 1 to 2 minutes, maybe 5 minutes. In those instances, if they're not charging you a dry needling charge, they're bearing the cost of that in the context of your usual treatment and not considering it. However, few clinics do proper dry needling that's done in excess of 15 minutes. Obviously, with the level of skill, determination to help utilize the proper protocols and the time that you're receiving dry needling for the maximum benefit, that carries a reasonable charge. The current charge for dry needling is $75 per session. That $75 is oftentimes reduced for individuals who might have an out-of-pocket expense. And it's also reduced for individuals who are paying entirely for their own care out of their own pocket instead of utilizing insurance reimbursement. Again, we want to offer dry needling that's both effective and that's honoring the skill, expertise, and the true cost of doing the best job of helping you get back to your active life as fast as possible.